think beauty to me means when you're very comfortable in your own skin. I think beauty is when you're so comfortable with yourself that you can actually pick out, I think I look really good, but these little lines bother me. What can we do? It's not the tragic makeover that people think. It's the little things because patients really come in with small little things that bother them. And that makes me feel good because I think, you know what? You're confident enough to only find one little thing with yourself. That's okay. So beauty comes within your confidence. And I love when my patients come in with that.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Cynthia Durieux of San Antonio Cosmetic Surgery, who's an advanced aesthetic nurse injector with over 33 years of experience in plastic surgery and 18 years specializing in injectable aesthetic procedures. She has worked alongside top board-certified plastic surgeons across San Diego, Maryland, Dallas, and San Antonio. Cynthia is known for her natural, patient-focused approach, combining science, artistry, and compassion to create timeless results. Fluent in Spanish, she's passionate about educating and empowering patients through every stage of their aesthetic journey. So Cynthia, welcome and glad to have you here.
Thank you, Daniel. Thank you for inviting me.
Yeah, so let's start off with this. How did you first get interested in medicine?
Funny story. I was a medical assistant in San Diego and I was working for a cardiologist, and he would always throw his charts at me. He was not very nice, and I went home crying at the time. I said, I don't think I want to do this. And someone said to me, hey, there's a plastic surgeon looking for a medical assistant. I said, I don't know anything about plastic surgery. Walked in there and literally grew up there for almost 11 years. I started
Wow.
as a medical assistant. They taught me how to circulate in the operating room. I assisted the nurses in the recovery room. They taught me how to close surgery, so I did all the financing. I literally grew up, I was 22 when I started.
Wow.
I left there and I never thought, I'm married at my husband. He was in the Navy. We moved to Puerto Rico and I thought, I've got 3.5 years here. Why don't I go to nursing school? And yet again, I didn't think I was staying in medicine. I moved to Maryland and I applied. I'm that old. I applied for a job from the newspaper and it said PACU. And I thought, I've done that before. I walked in the door and it was a plastic surgeon's office. And so I felt it was just my calling ever since,
Mhm. Okay.
state to state that I moved, being that I was married to a Navy man.
Mhm.
I always kind of found a home in plastic surgery.
Okay. Sounds like it was very serendipitous. You just
Yes,
ended up in
absolutely.
plastic
Very,
surgery.
very.
Okay, so then now when it comes to to the practice, San Antonio Cosmetic Surgery,
Mhm.
and obviously it's cosmetic surgery, but also there's
Yes.
the aesthetic sides of that as well. So
Yes.
between the surgery and between the aesthetic sides, can you tell me a little bit about the common treatments or conditions that your patients typically come to you for?
So I work for a plastic surgeon, a board certified plastic surgeon. His name is Delio Ortegon. He's been in practice since 2007. So his specialty is all from the body only. So he does breasts, tummies, lipo, thigh lifts, arm lifts.
Mhm.
I specialize in everything that comes from the neck up. I do all facial injectables. I do Botox fillers. I do biostimulators. I do lasers. So it's kind of a really nice balance. He really dedicates most of his time to the lower half, and I do the upper half. I also join with him in the peptides. I actually do the weight loss clinic here with tirzepatide and with semaglutide. So we kind of prepare patients that are ready to have surgery that are not quite there in their weight. That way they have a successful journey with a tummy tuck or an arm lift or liposuction. So we get them there. So I've been very blessed that in these 33 years, I've worked for 6 amazing plastic surgeons that really have taught me um, all the importance of anatomy, safety, that have made me who I am today, to be quite honest.
Wow. Okay. And
Mhm.
this is I don't know how common this is that you have all these different areas within one practice. You have the surgical side, you have the non-invasive aesthetic side, and you also have the wellness side, the weight loss side, and all that.
Okay,
So,
absolutely.
so I guess what led to deciding to put all this into under one roof?
Well, actually, I came into his practice about 10 years ago and he did not have an injector. So he brought me on board and, we just started, he said, look, I don't like injecting. I like doing surgery. So we'll take care of this. you do the injectables, I'll do this part. And with time, I've actually grown in this industry. Like I said, I was 22 when I started. I don't mind saying I'm 59. So I've seen this industry really grow from where it was only the 50 to 68-year-olds doing cosmetic surgery to
Mhm.
now it's the 22-year-old doing cosmetic surgery. So we were able to combine because him and I have a great understanding. We stay safe, we stay within our bubble in the sense that we're going to do things that are right for our patients. I also manage his practice, which even adds more to it because I manage his practice. I actually work his practice and I help with, all the integration of what gives us revenue, what keeps us flowing, HR, payroll, all those wonderful things. So I'm pretty lucky actually that I do a little bit of everything in my job. I like it that way. I think my first job that taught me how to jump from one thing to another made me a very good multitasker.
Okay. Well, it sounds like you have your experience in every single aspect of the
Yeah,
practice.
actually, yeah. So I'm not boring. I keep telling myself, I wear
Yeah.
different hats and I've learned to really manage my time well. I was at a meeting recently with all these nurses and I actually wrote an abstract on this, the ASAPS meeting for interventional plastic surgery nurses. And this is what I talked about, the fact that I'm able to do these three different jobs, and you can balance it. But
Mhm.
at the same time, it's, your patient safety comes first. So I think both Dr. Ortegon and I are on the same page. So that always is very important in this industry because it is all elective. Patients don't bring insurance. We don't accept insurance. We try to make sure that we give our patients all the information, all the literature, and never enforce our ideas or our kind of like, oh, you need a tummy tuck with your breast augmentation and lipo. What bothers you? And then we'll help you. And if you're a good candidate, we proceed. And both Dr. Ortegon and I are the same way. I have patients that come in that are beautiful and they try to find things that they think they need. And I'm like, no, you don't need anything. You look beautiful. You're still too young. Go ahead and enjoy, wear sunscreen, put a little vitamin C, and you're good to go. And
Mhm.
I'm okay with that. It's not really always about the almighty dollar. You've got to keep these people grounded and safe. And unfortunately, I think the little black box, the internet, the Instagram has made it harder for the younger people to understand that. I think they, with all this morphing of bodies and faces, it makes it very hard when a patient comes in and says, I want my lips to look like this, or I want my forehead to look like this. And I say, it's photoshopped. You don't have that anatomy. So, we've made a good team here, and I think that that's important in a practice. I think again, it's very easy to kind of run with it and just let your patient go and just say, sure, you need 20 syringes of this and 5 syringes of that, and you think of the money, but at the end of the day, it's really what are you presenting to your patient and how safe are you being? And then people get to know you for that kind of injector or that type of surgeon because we have those in town. We know who they are, and it's in this whole industry across the country, all different surgeons. People are known. So you try to stay within that kind of comfort zone that keeps everyone safe and happy.
Okay. And you kind of touched on this a little bit earlier, but how do you, I guess, decide one treatment over the other? And I think you have a very unique perspective on this because you do so many different things within the practice. So is it typically pretty straightforward that someone comes in and it's like, oh, I want some type of surgical treatment or non-surgical or weight loss? Or is it sometimes people come in and you kind of have to guide them into what's going to be the best fit for them or not?
I think people usually come in and they know what they want. They either know they want a tummy tuck, a breast aug, or a breast lift. Once they're examined by the doctor, he's able to determine, you may not need a lift. Maybe an implant just will be fine for you because your tissue will tolerate just putting an implant and giving you the volume you're looking for. Oh, I think I want liposuction, but you have extra skin. Then we have to educate them and say, no, it's really a tummy tuck because if we liposuction, you're just going to have extra skin. Same thing with me. They walk in the door and they think, I think I need filler, in these little wrinkles around my eyes or my forehead. And I'm like, no, that's Botox. So there's still that education of trying to teach them the difference. Even though there's so much out there in social media, you still have to guide them a little bit, and know that baby steps are better versus trying to bombard them with so much. I think that that's been one of my keys. I also have, because I have a heavy background in plastic surgery, my second plastic surgeon that is based out of Florida now is in Maryland, Dr. Oscar Ramirez. He's a facial plastic surgeon that's world renowned. And I literally was 3.5 years there learning facial anatomy, made me the strong injector I am now because now I can see beauty differently. I can see the balance in things. And it's not just because it's on a paper and you do one, two, and three. I can see, the balance between the eyes, the tip of the nose, the chin, the jawline, and how you can balance all these things. And it doesn't have to be with 100 different kind of products. You can really kind of engage your patient and educate them and go, wow, I never thought about that. I just need a little bit of this here, and that'll balance me out. I thought I was going to have a whole facelift. So it's a little bit of everything, but I think you still have that educational guidance you need to give your patient so they're aware and social media doesn't get them a little distorted.
Yeah, well, especially with all the filters and then now AI,
Yeah.
you don't know what's
Mhm.
real and what's not real.
Oh yeah, yeah. Now we have medical tourism that's really, really impacted this industry. You have a lot of people now that don't want to come to the States because they want to go outside because it's less expensive.
Mhm.
We're in a border town, so we have that happen to us. And patients have gone out and come call us and say, "Hey, I have a hole under my breast after breast augmentation. Can you see me?" And we're like, "Where did you go?" Mexico. And we're like, "Well, you know, these are the things that happen. I've been injected with something, and I've had a girl come in with 4 times the size her lips. And
Ooh.
I said, "Where did you go?" To Mexico. What did they use? And they used a product that wasn't FDA approved and
Mhm.
was done in a technique that was not approved either. And so you have those things happen. And so people right now, I think, are still at that wanting to cut corners, but they don't realize how unsafe it really is. There's a reason why plastic surgeons charge what they charge. It's not just because they want to make millions and millions of dollars, it's their years of education.
Mhm.
The insurance that doctors pay, malpractice, and all those things are very heavy. We have accreditations for these doctors that keep them safe. Other countries don't, and that's why it's less expensive. And so, same thing with us as injectors, we stay within our bubble. We are injecting a medical device. So, people sometimes don't understand that. They just think it's like, well, Sally down the street does it for $5 a unit. Why do I pay you 13? And I said, well, I have 18 years experience. I'm a nurse. I'm going to stay safe. I'm going to give you FDA approved products, and I'm going to walk you through this. You're going to walk away with my cell phone, which I always do. You can text me if you have a problem, if you have the fear of something. So it's that kind of, I think, conversation sometimes that lacks in this industry,
Mhm.
that makes people just jump all over the place.
Okay. And you bring up a really good point as far as what people need to keep an eye out for and be aware of. But what is some other piece of advice you would give people who is looking to get some type of aesthetic treatment done, but isn't quite sure which provider to go to?
Well, I think if it's cosmetic surgery, definitely a board certified plastic surgeon, not a cosmetic plastic surgeon or a cosmetic surgeon, because that's totally different. A board certified plastic surgeon is certified by the Society of Plastic Surgery, which is very important.
Mhm.
That means that's what they specialize. Cosmetic surgeons are not. It's a whole different realm. There's only, I think, like 22 board certifications in medicine. So that's not one of them.
Mhm.
Okay, but they
Mhm.
get caught into it because it sounds good. So that's the first thing. Second, I always tell patients do at least 2 interviews, meet 2 doctors. Make sure you're getting and you're comparing apples to apples and that you're getting, hey, I want to see your pictures. What's going to happen to me? How many times are you going to see me? What's my recovery going to be like? Who can I call if I have a question? Have that conversation. For me, it's going to be look at my background. You can now it's no longer just pick up the phone and call. It's like you look at my Instagram. People want to see, well, what have you done? People look at YouTube and they see, I've seen you inject before. They look at our reviews. We're very blessed. Our reviews speak highly for us. I will tell you that the person that sits in my chair that's brand new, 90% of the time will say, how did you hear about me? I say, I Googled you and I
Mhm.
saw your reviews. And I'm like,
Mhm.
oh, great. And if that's what helps them, and then you educate them and they don't feel like they're giving a sales pitch. And to me, that's real important.
Okay. So, and you mentioned some really good items in there. Is there any other red flags that you would tell people to be cautious of when they're looking around for providers?
I think the things to be cautious of anything that's too cheap or too easy to pay off. Like we've
Mhm.
got this payment plan, you can pay in-house and we'll make all these different payments and we'll get you in as soon as possible. The cookie cutters, the
Mhm.
ones that'll get you in really fast. There's a lot of those around here too, and in other
Mhm.
areas that I know, they make it really easy for you.
Mhm.
When it's too good to be true, that the product's really, hey, I've got a special for a lip filler for $200, and you can get 40 units of free Botox, all that stuff. You got to be real careful because unfortunately, in this industry now, people can actually buy these products online. They're not FDA approved.
Mhm.
I went down a rabbit hole the other day all on Botox. It's called Inatox, and it's a Korean product that you can actually buy online. And these girls are actually buying it for $50, and they're actually teaching themselves how to do it. And they don't know how dangerous that is. But those are the things you want to look for. Anybody that says, come to my house and I'll do it, or, those kind of things that are just going to be, it's too good to be true. It really is. When you have cosmetic surgery, this is something that you want to have done. You don't need to have it done. When you have injectables and facial treatments, you want them. You don't need them. So you have to make sure you feel comfortable and there's a relationship. You're not just a number. You're not just someone in line to go in and out.
Okay. Great advice there. And now I want to go back to the treatments and I want to
Mhm,
talk a bit more about combination treatments. So
mhm,
I'm sure you get some people coming in for
mhm.
combination treatments. But what does that, I guess, conversation look like? Is it kind of like you try to figure out what is the end goal they want, and then from there you put together the different treatments, or is it they start with one and then from there they feel comfortable that they want to do something else? Like what does that journey typically look like?
Well, when it comes to surgery with Dr. Ortegon, usually they come in with one thing. I want to have my breast done. And we stay on that ground. We never go to, well, since we're already here, that's never been his platform. And it's funny because I've had patients that are like, man, he didn't push me into anything. And then I've had a couple of patients, well, why didn't he tell me that I had this? Because that's not his job. His job is to educate you on what you find as a problem. Now, for me, it's different. Patients come in and say, I don't like this jowling and I don't like this wrinkle and why am I so flat? And then I go through the basic anatomy to them. As you age, you lose collagen. You don't make collagen after the age of 22. You lose muscle, you lose bone. So now how are we going to restore it? Are we going to use a biostimulator that's going to help you build collagen slowly? Or do you want a volumizer like a hyaluronic acid that's going to give you instant gratification? What area bothers you first? And then I always start with that. The one thing that bothers you the most, let's start with that. And then they slowly start to say, you know what, Cynthia, you did my cheeks and I love them, but now I notice that my lips look really small. How do we balance? Okay, now let's start adding to your lips. Or we do your forehead for Botox or the 11s that really common. They're like, that's all I want. They start to smile and they're like, hey, I'm noticing my crow's feet. Okay, well, let's add that the next treatment. They themselves then feel a little bit more comfortable when they're not being pushed to so many plans. And they always walk out of here with a goal. Like I always will make sure, like I give them a quote. I said, I'll give you these options. And most of the times I will be like, go home, think about it. It's a lot of money. Don't feel pressured. And some patients do. I would say I'm pretty blessed. 80% of my patients that walk in already know what they want, and we have a plan and we work on it very well.
Okay. And you brought up another point in this as far as men asking for treatments. I think that the aesthetic industry has mostly been female dominant as far as females
Mhm,
looking for the treatments.
mhm.
But are you seeing more and more men starting to get treatments, or you think it's still kind of the same as far as not many men come in for it?
I think men are getting a lot more comfortable. I think men are getting, but I think it's coming from the girlfriend saying, hey, you could lose a little Botox around your crow's feet, or have her talk to you about those lines across your forehead, or the husband and wife, where the wife comes in and she's like, hey, can you treat my husband since I'm doing a treatment? And
Mm,
the men are getting better with surgery too. One
mm,
of the most popular surgeries for men in our practice is going to be gynecomastia, which is the excess breast tissue that they
mm,
have. And
mm,
they start at a young age and they deal with it for a long time, then they realize it's going nowhere. And it's actually breast tissue that is grown like, a woman. So
Mhm.
we do that surgery and it's very common and they're very comfortable. Liposuction after losing weight or not being able to get rid of the love handles for the men. So we have there, it's come a long way from when I first started. I think men are getting a lot more comfortable. That is for
Okay.
sure.
Okay, that's good
Hmm.
to hear then. Now, I'm curious, I'm sure you get a lot of misconceptions. You hear a lot of myths from your patients and your clients about some of these treatments. What would you say is some of the most common misconceptions you hear?
I think for me in my industry is everyone thinks they're going to look like a housewife
Mm,
from the TV shows. They're
mhm,
very worried that they're going to walk out of here looking overdone. And I have to explain to them, you have to understand that those women are in front of a camera. So everything they do is overemphasized. So there's surgery, there's filler, there's Botox, there's all these things impacted to one person with a lot of makeup that has that look. And so that's a lot more than what I'm going to do. I'm not going to put 20 syringes in your face. I'm not going to do your makeup like that. So they have to understand that. And those women have usually had some kind of cosmetic surgery in their face. So I think their fear is always that they're going to look fake. And you have to really kind of hold their hand through them and explain to them basically how these products work and how much it would take to make you look like that. So once they understand kind of the way either a hyaluronic acid, which is a filler, or a biostimulator, which is going to stimulate collagen, is going to work, or a toxin like a Dysport, Botox, or Xeomin, I think they feel a little bit more relaxed. Then they're kind of like, oh, but I saw here. And I'm like, yeah. And then you have all the other stuff that is really fantastic. A patient that walks in and shows me, I want a jawline just like that. But they don't realize that the model probably weighs like 90 pounds. So you put one syringe of filler and it gives them a beautiful jawline.
mhm,
When the normal woman has a round face and it'll take three. And I'm like, well, if you want to get to that, it adds more. And they're like, oh my God, that looks so easy. I'm like,
mhm.
a lot of it is filter. A lot of it is just playing with marketing. So you have to be real careful.
Okay. So it's really going to depend on the individual, but also, from my understanding, it is kind of hard to make yourself look fake unless it's just a really bad injector or like you're intentionally trying to put more and more and more and more.
Absolutely, absolutely. And we have them, we have injectors that just don't want to say no, and if they come in and they know that they're, like it depends like how much you sell and how much you do, you're going to sell that product. They're going to put the patient out there and go, it doesn't matter. It comes to integrity as an injector, it
Mhm,
is your name. I live in San Antonio, it's a small town. It's a big city feeling, but it's a small town and we
mhm,
know all our injectors and we know patients will definitely, jump from one place to another place because it's cheaper here. They had a special here, and then they come back to you going, "Oh, I cheated on you. I'm sorry," or something happened to me. I'm sorry. I went over here, and you're like, "It's okay." And you learn as you go on in your practice that at the beginning you're very eager to please everyone. So you say yes to everything and you do everything. And as you kind of settle and understand how safety is such a big concern with fillers that you step back and go, you know what? No, you're not going to be my patient. This is a red flag for me. You can find an injector that'll try that for you, but I'm not going to be the one for you.
mhm,
So there you kind of learn that you have to take a step back and say, this is not safe. This is not beauty. This is beyond that.
mhm. And it's kind of funny sometimes when you say no to them, they trust you more and they actually want it
Yeah,
more.
absolutely. I get one thing, I don't inject noses. Okay. And
Mhm,
it's one of those things that you see a lot on Instagram and, social media. You don't have a nose job, inject it. I don't do noses. They're the most unsafe injectables to do. I spend an average of a lot of money during the year. I do at least three courses a year of different types of surgeons. And basically, they all spend the majority of the time talking about vascular occlusion, which is one of the most common things that could happen when you inject a filler. If you have an occlusion, there's no blood supply going to the tissue. You only have a certain amount of time to actually clear that up before you can kind of release that blood vessel. And it's drilled into your head. And the nose is one of the unsafest places. And but I see it and like, I'm not going to be the one. I said, I like to sleep at night, and
Mm,
I don't want you having to call me, at 2, 3 in the morning in a panic, and I can't get to you fast enough.
mm,
So those are things that, that are coming up that you see, and it can happen all over the face, but the nose is the one of the most dangerous ones. So for me, I like to stay within the guidelines. I like to stay within what's safe and is what comfortable for me and my patient.
okay. And Cynthia, how important do you think having an artistic eye is in what you do and how you approach patient care?
Very important. I think facial anatomy and knowing your anatomy is very important, but you have to have an eye. You can't be a little robot injecting 1, 2, and 3, 4, 5, and 6. I'll tell you that when I was trained a long time ago, you didn't train with the fear of these vascular occlusions. These companies, big companies, that would teach you as a nurse. They say, okay, here's your injectable. You place it here, here, and here. You balance out the face. You look at this, and away you go. Now, all you're taught about is basically how are you safe, how you don't injure a patient. I've done 3 cadaver trainings, where you actually work on cadavers and you cut into the tissue and you're seeing all the things you don't see every day with the clear eye. So you have to have kind of that conscious awareness that potentially you can hurt a patient. So artistically, you have to see the balance. And I think it's very important. You just can't be that kind of like anatomy only, and that's the only thing, because then you only get color by numbers. I think you don't get a balance.
Okay. And now, Cynthia, throughout your career, I'm sure you've come across some challenging cases, or at least memorable cases. Is there maybe one story that you can tell, just a challenging case, a tough case, one that just sticks out in your memory, and how you were able to get them a great outcome in the end?
I had a young girl that was injected at home by someone that told her she worked from her house.
Mm,
And she used a pin that had a bunch of little needles on it. So every time she poked it, the the product would come out. Okay.
mm,
She walked in my door wearing a mask, and the girl up front said, she's here for a lip consult. And I thought it was strange because it was not through COVID. So I thought, okay, so maybe she doesn't feel good. When she took her mask off, her lips were literally probably 5 times their size. And
whoa.
I was in shock. And I said, what did you do? She said, well, this friend of mine told me she was going to inject me with this great pin that was going to make it easier for me. She said it didn't hurt when she injected me. And I was sore a little bit. And I walked out and I thought, oh, this was great. And the next day I woke up and it was this.
Mm,
And I did not know what to do. The girl told her what the product was. It was not an FDA approved product from the United States.
mhm,
So I had to use something called Hylenex, which is a product that eats the enzyme, the HA, to bring it down. And we had to do it multiple times. And it was really hard because at the end of the day, she was thinking, I'm paying $200 for something that she thought was going to be a great result. And now she had to pay multiple sessions of Hylenex to kind of bring her back to a normal state.
mhm,
And it was one of those things that was hard for me because it was sad to see that someone took advantage of someone so young, and now she was stuck with these lips that had to be dissolved time and time again. It was going to take money for her, it was going to take time off of work for her. She was embarrassed and she was scared. We
mm.
finally got her to something that was comfortable for her. She had a little bit of fullness, she was happy with that. She was embarrassed, but she was very grateful, and that made me feel really good.
Yeah, and I think that's really the uh, unaware dangers that people need to be aware of when they try and go the cheap route. Is that it
Yeah.
happens like this? They try and go cheap. They pay for a treatment. Something like this unfortunately happens to some of them. Then they
Mm.
have to pay even more to get it
More.
undone, and then they have
Hmm.
to pay another amount to get it done like the way they should have done it the first time.
Absolutely. And it happens with us in our cosmetic surgery too, with Dr. Ortegon. Patients, like I said, they go to someone that does, oh, yeah, this is really cheap. I can do it for very cheap. Come and do a tummy and this. And they don't do like with tummies, they just pull the skin and they don't
Mhm.
do muscle repair. So they still look barreled out. And they're like, why do I look like this? And he's like, well, because when they did the tummy, all they did was pull your skin, but they didn't sew all the muscles internally that make you flat. So
Mhm.
you're still going to pooch out. So now we got to go back in there and do it. Or a breast augmentation where they don't place the implant in the right pocket and they bottom out. So Dr. Ortegon has to go take that implant out, make a new pocket for them. So now they've spent two implants, one with the first surgeon, one with us, operating room time, anesthesia time, time off of work, and they don't realize it because they think, well, it's only going to cost me $50 a month for the next 12 years. Who can do that, and
Yeah.
they don't realize in the long run, everything that, and psychologically what they go through, because then they're really hard on themselves.
Yeah. Yeah. No, it's a great story you tell. It's something people should be
Hmm.
aware of is that you really
Hmm.
want to focus on quality first, get it
Yeah.
done right the first time.
Yeah, absolutely. And sometimes people will complain, like, why is there a consult fee to see the doctor? He's a surgeon. He's going to
Mhm.
spend time with you. And if you book, we will deduct that from you. So it's, you don't want to see. I used to work for a surgeon that never charged anybody to see them. And he wasn't the best, and he was quick and he was fast. And, didn't take me very long to realize that that was not a place for me. But, it's that time he didn't take with these people that I was like,
Mhm.
that's not fair to the patients. So here we spend time and patients will come back over. I want to go over it one more time. Can I ask them a second question? Can I go over? And we give them that. We want to make sure that they feel comfortable enough to make their decision.
Okay, that's fantastic. Now, Cynthia, where do you think the future of aesthetics is going?
I think it's going to be definitely in regenerative medicine. I think
Mhm.
a lot of it is going to go into all these peptides, all these are regenerating collagen. I think anything that's going to be regenerative. I really do. I'm in the process right now getting certified in peptides. My boss would like us, we do right now trizepatide and semaglutide, which are peptides, but
Mhm.
we want to get into more of how to stay healthy, how to have less brain fog, more
Mhm.
alert, less joint pain, things like that. So going through a process of learning this has been kind of fun. I just started it. It's a lot of work, but
Mhm.
I think you have to be safe because here we are again. People can look up peptides, order them online, and get them, and don't understand the actual mechanics of your cell and why you can take this peptide, how long you can take it. You can't just combine it, and the purity of it is very important. And I think that's where we're heading. I think women are go into trying to do more of the biostimulators,
Mhm.
which are going to be more collagen, because we lose the collagen instead of like the volumizers.
Mhm.
They're going to be like, yes, I want in my lips, but maybe not so much in my face. What can we do? Ablative lasers, something that's just going to refresh the skin, doing a lot more growth factors, exosomes, stem cells, all that stuff. I think that's where we're going to head on. I
Okay.
really do.
So
Mhm.
more wellness, more
More wellness, yeah. Things that are wellness, cosmetic, but still just kind of cutting edge, where they could
Mhm.
still get a change.
Yeah. So I guess
For
it's more
sure.
like starting from the inside and then to the outside versus
Outside.
traditional is like more outside or
Hmm.
just really outside, not really much
Outside,
inside.
outside.
Yeah.
Yeah.
Okay.
And
Got it.
I will tell you, I get teased a lot in my practice because my girls will knock on my door and it's just like, it's not therapy time, Cynthia. You have another patient. I said, look, I will spend as much time as I have to with I mean, throughout these years, I've gone through divorces,
Mhm.
cheaters, left families, fathers died, mothers died, loss of children. I have made bonds with these people. And
Mhm.
it's very important to me
Mhm.
as an injector to have them feel that way. It is money out of their pocket that they don't need to spend, but it makes them feel better to know that someone's going to do something to make them feel a little bit better when they look in the mirror. And if that makes them happy, I'm okay with that.
Mhm.
As long as it's within the bounds of what is normal and safe.
Okay.
Again, that I go back to that every time.
Yeah. I think that's a great segue for this next question. What is the vision for San Antonio Cosmetic Surgery?
Um, Unfortunately, my boss is younger than I am. He's 55 and he's planning to retire. He's like ready. He
Mm.
has a ranch and he threatens to basically retire. He's like, I'm ready to retire, Cynthia, and I'm like, Dr. O, but I'm not, I may be 59, but I'm still ready to kick and go. So we have, he's thinking what we can do together combined, that I can still keep doing what I'm doing. And he does surgery twice a week and he does consults twice a week and then he gets every Friday and weekend off. So I think we have a great combination. I, on the other hand, work 6 days a week. I love what I do. I don't call it a job. So as long as I still get up and say I don't mind like injecting and talking to patients, It'll just see, I don't want people ask me, why don't you go on your own? I like the comfort of having a surgeon. I like the comfort of having a relationship with a plastic surgeon that has my back, that is here for me and for my patients. I think that's very important. I think it makes the patient feel comfortable and safe. And we kind of basically are able to treat all complete, come in for cosmetic surgery. Oh, I didn't know that you get laser hair removal. Oh my goodness. Oh, I didn't know you did Botox. Oh, you did filler. So it becomes kind of a home for someone, and
Mhm.
that makes me feel good. So I'm hoping that I can keep him here still a little bit longer.
Lock him up in the office. Don't let him go
Yeah,
home.
exactly. Even if he
Okay.
has to telemedicine for me,
Yeah.
that's fine. I'll be like, just send me the okay on the prescriptions and I'll be okay.
Okay. Well, Cynthia, I have one last question for you, but before
Sure.
I ask it, I do want to point people to your website at sanantoniocosmeticsurgery.net.
Thank you.
Now, last question is, what does beauty mean to you?
I think beauty to me means when you're very comfortable in your own skin. I think beauty is when you're so comfortable with yourself that you can actually pick out, I think I look really good, but these little lines bother me. What can we do? It's not the tragic makeover that people think. It's the little things because patients really come in with small little things that bother them. And that makes me feel good because I think, you know what? You're confident enough to only find one little thing with yourself. That's okay. So beauty comes within your confidence. And I love when my patients come in with that. They do. I have the 50s, 60s. I even have an 80-year-old patient that still comes in and she's like, Cynthia, will you do a little filler for me? And I'm like, well, it's not indicative. It makes me feel better, Cynthia. I like the way I look in the mirror. And I'm like, okay, if it makes you feel good, it makes me feel good.
Okay, there you have it. Great answer. So thank you, Cynthia, for sharing your expertise. Where can people contact you in the practice?
In the practice, they can contact me. I have an Instagram, CDURIEUXX. That's where you see most of my content. And then our office number is 210-614-4320. I'm always available. But the website, we have a great lead. We're on Facebook. Patients always come up with questions, and we're really good about having that contact with people. So we have a great team here. It makes a huge difference, I will tell you. The team we have here. I counted the other day. We have 94 years between everyone that works
Wow.
here of experience between my closer, my front desk, my medical assistant, and myself. That's not counting Dr. O.
Wow.
So,
Wow.
yeah.
Well, Cynthia, this is awesome. Thank you so much for coming on. Thank you for sharing your perspective and your expertise.
Thank you for your time. It was a pleasure meeting you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.